Hello, my name is Sharif Gorgi. I'm a third-generation pharmacist from Toronto, Ontario. This is clearly an exciting time for pharmacy as we shift from pills to patients, as we shift from technical dispensing to patient-focused services. And I believe that this is a necessary and inevitable transition. So my message to all pharmacists today is that now more than ever we need to be agents of change in our daily practice. We need to remind ourselves of why we got into this noble profession in the first place, which is to really have the opportunity to make a difference in the health outcome and well-being of our patients. I'm confident that pharmacists all over the globe will embrace their evolving role, will successfully embark in this new era of pharmacy practice, and will capitalize on all the new opportunities that are still ahead. I'm Sharif Gorgi, and I'm very proud to be a pharmacist.
That's a proud pharmacist. Now, do you know who your local pharmacist is? What is the reason for a visit to your local pharmacist? Is it to go and grab some cosmetics, some supplements, some headache tablets, or consult for some other health-related problem? Are we even familiar with the role that the pharmacist plays in our health and well-being? Well, today we discuss pharmacy in South Africa. We'll focus on the pharmaceutical landscape in South Africa, policy and regulation issues such as, for instance, factors that determine the price we pay for medicines, the registration and licensing processes, practice standards of the pharmacy, and the role that the community pharmacist plays. Now, we'll be joined in studio by the Chief Director of Sector-Wide Procurement from the National Department of Health, the CEO of the South African Pharmacy Council, the Head of Public Affairs from the Pharmaceutical Society of South Africa, and last but not least, the Executive Director, South African Association of Hospital and Institutional Pharmacists. Now, you may want to be part of the show by asking the panel some questions or simply just sharing your views with us. In that case, the number to call is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk or simply interact with us on our Facebook page, SABC Health Talk. Now, we're going to go for a short break, and we invite you, when we come back, to sit back, relax, and learn from this bumper show ahead. I'm Dr. Sello Mutaung, and this is Health Talk.
If we are talking health, then let's talk seriously.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est si bon.
Rights and recourse tackles constitutional issues.
When South Africa became a constitutional democracy, we had a fairly sound legal system in place requiring the Constitution to guide the direction in which it must go and the way in which it must be refashioned.
The Justice Ministry, the custodian of human rights.
We actually have a plan to come up with a comprehensive review of our human rights instruments.
Advocates dealing with evidence.
Sometimes you have to use a crook to catch a crook. So we expected that the credibility would really be taken to task. You try and consult your witnesses and prepare them as best as you can.
Hashtag Rights with Dumila Matez on legal issues every Sunday at 2 o'clock Central African Time.
MedShield, embracing our members in good health since 1968.
Africans are increasingly using digital platforms for life, work and play. Information is key for us. We live in an information age. We live in the digital age.
I'm mostly on WhatsApp because not all my friends have iPhones, so they don't have FaceTime.
On Network, we tell you about Africa's technology and social media landscape.
And some here are using the internet to raise political concerns.
Some of the exposés on political issues come from what we call your diasporic online media.
Africans are also using technology to create. For African technology and social media news, join me, Phumelele Zondi, on Network every Sunday at 9 p.m.
Hi, my name is Tanushya Pillay and I'm the pharmacy manager here at Mediclinic Sandton in Johannesburg, South Africa. I'm also the current president of the South African Association of Hospital and Institutional Pharmacists and the vice president of the Pharmaceutical Society of South Africa. Okay, so this is a private hospital in Sandton, Johannesburg. This particular hospital, under the pharmacy or under the responsibility of the pharmacy manager, falls the front shop. We've got a retail section for dispensing to retail patients. And then where we are now is the hospital pharmacy, which services the wards and the theatres if needs be. We also have a surgical stores, which supplies surgical sundries to the wards and to theatre, and a theatre pharmacy as well, which sees to the needs of the theatre. So one of the things I'm particularly proud of here is that we were able to get a pharmacist to go up into the ward to do ward rounds. It of course takes a lot of encouragement on my part, because you've got to encourage the pharmacist. They need to overcome their being intimidated by the doctor and being taken out of an environment where they purely dispense downstairs in the pharmacy, and now they're face to face at the patient's bedside with the doctors, with the nurses, with the microbiologists, with a view to interpreting the scripts and giving advice then and there to the rest of the clinical team. So that's something that I'm looking forward to seeing as a successful program here at Mediclinic Sandton. At Edendale, we used to take 6 interns every year. There we had a structured program, and one of the things that probably set that internship program apart from maybe an intern doing it anywhere else was that you groom the intern to run the pharmacy like a pharmacy manager would. I'd like you to start and you give them the tools, you create opportunity for training, you give them opportunities so that they can interact telephonically or via SMS, or phoning, going up to see the doctor, getting information from the laboratory, and watching that pharmacist grow into it and overcome her own personal hurdles and obstacles, which is a big thing. Now that I am a pharmacist, I love being a pharmacist. I'm very passionate about the profession. I love teaching young pharmacists and encouraging older ones, of course, to abide by legislation and to play by the rules and to work nicely with the doctors. So now that I am a pharmacist, it's also created lots of opportunities for me in terms of SAHIP and the PSSA. And I am here today, I think, or I'd like to think, because of my career in Department of Health and my passion for the profession. I am Tanushya Pillay, and I am a pharmacist.
All right, she's a pharmacist, and there's a whole lot of other proud pharmacists out here. But we're going to learn more about, what the pharmacist is and the role that they play. But before we talk about, the role of a community pharmacist, we're going to start at the beginning. Look at the landscape of the pharmaceutical industry in South Africa. And I'm not doing that alone. I have 3 special guests for now. Let's start with the man in the middle, Gavin Steele, who's Chief Director, Sector-Wide Procurement from the National Department of Health. Welcome to Health Talk, Gavin.
Good morning.
Right. And closest to me on my left is Amos Masongo. Amos is CEO of the South African Pharmacy Council. Welcome to Health Talk, Amos.
Good day, sir.
All right. And last but not least, of course, furthest to me is Lorraine Osman. Lorraine is Head of Public Affairs from the Pharmaceutical Society of South Africa. Welcome to Health Talk.
Thank you, Dr. Sela.
All right. I don't know who's going to start with this, but let's start from the beginning. We hear about the pharmacist. Let's try and define what a pharmacist is, because oftentimes you hear there's a pharmacy assistant and so on. What is a pharmacist, and what does it take to become a pharmacist? Perhaps Lorraine, yeah?
Okay.
I think that the most important thing is to start with the medicines,
because
that is where a pharmacist's knowledge is really focused on the medicines, what they do to the body, what the body does to the medicines, what the best medicine is to give in particular circumstances, and obviously their training takes this into account. And a pharmacist in their training has to actually know absolutely everything that happens along the chain. So right from the research that goes into discovering a new molecule to putting it into a format that the public can actually taking it. There is the authority which makes sure that the medicine is registered, but it doesn't mean that it's just paperwork. It means that that is our proof that that medicine has been tested, that it's safe, that it does do what it says it does. And there are pharmacists involved every step of that way. And then we get to the reason why we are all in the profession, and that is that at the end of the line, there is a patient who has a need, and that patient has to have the correct medicine, and it has to be explained to that person in a way that they will understand and they will get the most out of their medicine use. And this is where our community pharmacists and many of our hospital pharmacists come into the picture, because they're the interface with the public. In the public sector, there are also pharmacists working in clinics or controlling clinics and making sure that if a pharmacist's assistant is there, that they have the necessary knowledge and skills to be able to communicate with the patient.
So what's the difference between a pharmacy assistant and a pharmacist?
The pharmacist has, at this stage, a 4-year undergraduate training program at a university, followed by a year as an intern, where they learn the practical application of their knowledge, and it is then followed with a year of community service. So they have quite intensive training in all aspects of this. Now, for the pharmacist's assistants, they don't need the same level or depth of training as what the pharmacists do. So they've got very specific training, which is at the moment about the level of somebody who has left matric, but there are plans to actually expand that, to make sure that they can actually do a lot more and have a lot more responsibility.
All right. Mr. Masango, I mean, from the council, I would imagine you register pharmacists, isn't that so? Yes. Let's firstly talk about how many registered pharmacists we have in South Africa, and whether or not, we have adequate.
Well, we have about 14,000 more or less pharmacists in our register. Right. They are not enough. Yeah. Because we have a plan to have at least 24,000 pharmacists by 2030. Right. So, and to get there is really a bit of a challenge. It's not an easy thing, but already we have spoken to a lot of universities, to start increasing their numbers. Some have doubled their numbers, they've managed that, but because of limited resources, some are still battling. But I must tell you that, from, just a few years ago, 3-4 years ago, our average production was about 450 pharmacies, countrywide. But at the moment we are sitting at just over 800, which is quite promising, because our goal is at least to produce about 1,200 pharmacies per year.
And timelines? When will you reach that target?
Yeah, it's also quite a big challenge at the moment, because we're also looking at some other new universities that must be established in the country. I mean, I'm talking here of Mpumalanga, and I'm talking here of Northern Cape, and I'm talking here of the Free State, which also have a university, but they don't take pharmacists. So if we bring everybody into that pot, then I think we will be able to this thing. But like as I'm saying, our goal is 2030. That by 2030, at least we should have enough. So we are working on that.
Yeah, and the distribution of the 14,000, are they mostly in the private sector, mostly in urban areas? What's the distribution like?
The distribution is that most of them are actually in the private sector. But public, there are not really many. And that's where most of the work actually needs to be done.
Well, let's hear from government. I mean, is there a major challenge? Well, I'm not necessarily saying let's talk about the public sector, but I mean in terms of the distribution of pharmacists.
So traditionally, you'll find in the public sector, pharmacists are in the hospital space. And nurses were predominantly running the primary healthcare environment. And so we, at the moment, at a policy level, looking at how do we improve pharmaceutical services at a primary healthcare level of care. And these things don't happen overnight. You know, these are massive resource issues. We have roughly 3,400 primary healthcare clinics in South Africa. I'd be surprised if 10% of them have a pharmacy personnel situated in that pharmacy. So we have a long way to go.
No. Let's for a moment, briefly look at the landscape of the industry in general. I mean, Lorraine, you started talking about, the importance of medicines, even though I'm going to come back to you on that, because we heard from that, first clip that we played, the pharmacist saying we're moving from pill to patient, so that, the focus is not so much on the medicine anymore. But anyway, let's talk about the industry. Perhaps take us through where drugs are manufactured right up to the time that they reach the patient.
That is indeed a very big industry and a very important industry. Right. And unfortunately, it's one that we don't have as many local manufacturers as I think we originally wanted to have in this country. So we do rely on some of the multinational companies, because they are the ones who can actually produce in the kind of bulk we need. With our 54 million people, we need a lot of medicine here, obviously. I think that in the moving from pill to patient, which is what the Canadian pharmacist said, a very important part of that is you cannot do that unless you have absolute trust and faith in the actual pills, the actual medicines that we are going to be supplying. And this is what, between at the moment, the Medicines Control Council and the pharmaceutical industry, this is what their main focus is. Safe, effective medicines. And obviously, it isn't just a case of manufacturing them and say, well, I think that'll keep nicely in the fridge for a week. They have to actually prove it all the time. They're constantly assuring the quality of the medicines. So it is a really important aspect. We cannot go to total focus on the patient unless we can say, okay, we can leave that to the pharmaceutical industry and the regulatory body, and we will know, there's no doubt, that medicine is good.
So talk about safe and quality medicines. There's issues around, sticking on to medicines for a while. There's issues around scheduling of medicines, and also generic versus, the original product, as it were.
I'll try to be very brief about the scheduling, but I believe this is something that the consumer needs to know, especially when they go into a pharmacy. Right. If you look at it, we start with medicines that are not scheduled. You can buy them in the supermarket. Why are they in the supermarket? Because if you take them exactly according to the instructions, and I'm thinking of simple things like paracetamol and aspirin, if you take them according to those directions and you don't take too many in the wrong time, they are going to be very safe. We then move up to medicines that can be bought without a doctor's prescription in the pharmacy, but that can only be sold by a trained pharmacist's assistant who is working together with a pharmacist. The reason that they are there is that in the pharmacy, your pharmacist should be the one picking up on, is it actually appropriate that you're taking this medicine? Maybe there's an underlying condition, and I'll give you a good example. What about things like coughs? What about pain? You mentioned headache earlier. If your headache is there so that you've had to use a painkiller for 10 days, your body's trying to tell you, please go and speak to somebody, get it properly diagnosed. Right. And then we step in with from Schedule 3 and above, where these are all conditions that you need to have a very correct diagnosis, and you need to be treated appropriately, and very importantly, your condition needs to be managed by a healthcare professional. And that is why we'll often say, we can help you to that point. Now, please go and see your doctor about getting it.
Gavin, we're going to go for a break, but I wanted to keep this in mind. There's often a complaint that we pay too much for medicines. Perhaps I'd like to ask you to just focus on the issue of what determines the price that we pay for medicines. For that, we're going to tackle that after the break. Please stay with us.
MedShield Medical Scheme. We don't just talk health, we do health.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
An exciting opportunity and an absolute must for those with the spirit of adventure is a Kruger Park night game drive.
The railway station itself is already a sight to behold and offers gracious colonial-style buildings and serves as the departure and arrival point for all train journeys.
I wanted to dress with my best color. Being awarded to do the Serpentine Pavilion is the highest commission in my career. And I wanted just to come and show me with my best clothes, and that is blue.
Catch trains travel every Sunday from 12 to 1 for all the global travel and leisure trends.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
Welcome back. We're talking the pharmacy, and now we're going to be talking about, policy and regulation issues that affect, the medicines that we take and the pharmacy industry as a whole. And with me in the studio is three guests. Amos Masango, CEO of the South African Pharmacy Council, Lorraine Osmal, Head of Public Affairs, Pharmaceutical Society of South Africa, and Gavin Steele, Chief Director, Sector-Wide Procurement from the National Department of Health. Let's start with you, Gavin. We spoke about people complaining about the high price that we pay for some medicines. And it's every time you hear about the story. Now, what determines the price that we pay for medicines?
So there's local issues and there are international issues. I'll start with the international issue. When a new medicine is discovered, just like any other commodity, the person who's discovered it may register a patent. And what that means is that no one else can make or sell that medicine, typically for a 20-year period. So they have what we call market exclusivity.
Right.
We have some tools in South Africa. We are a member of TRIPS, which is an organization that deals with patent protection. Right. And we do have some tools available that if in the interest of public health, we need to release ourselves of patent obligations. We can do so, but there's quite a complex process that needs to go through, and to date we have not needed to do that because usually when we talk to the manufacturers, they give a voluntary license. Like any commodity, competition is what drives prices down. And so once a medicine has got to the end of its patent period, then a generic medicine may be manufactured and sold in the South African market.
Okay.
And with that, I'd like to sort of say to the audience that it's fairly important to feel very confident about the quality of that generic medicine.
Often that's a complaint. Yeah. Just hold it there because we have Fortunate on the line from Johannesburg. Fortunate, welcome to Health Talk.
Morning. How are you?
Good, how are you, Fortunate?
I'm good, thanks. So, I just asked because, recently passed my matric, and I'm, on a gap year. So, I applied for medicine at first in UP. My marks were exceptionally great, except that I didn't really do great in NBT. So, now, now I can realize when we were discussing now in the shows that I can maybe pursue chemistry in pharmacy. So I just want to ask if of any maybe bursary opportunities.
The line is unfortunately bad, but I take it what she's saying is that she applied for medicines and her marks went, you know, to the level where she could be admitted, and she wants to know if there's opportunity. I remember because she's saying, I mean, are there any sponsors for her or opportunities to study the pharmacy? Anybody would like to take a step?
So there are many role players in the industry that offer bursaries. So some of the big pharmacy chains offer bursaries. There are the universities will have assistance programs for her. As government, each province will sometimes issue bursaries for people to study pharmacy. So I think there's a fair amount of opportunity, and if she has got very good marks, there's a good chance of her being successful.
Right, okay. All right, let's talk a bit about, you know, what we started talking about, you know, the issue of generics. You know, I mean, you spoke earlier about the patent period, which sometimes people complain that, you know, it is far too long in certain instances. And in fact, to a point where people say it's cheaper sometimes to buy medicines across the border, you know, at prices that are far lower than they are in South Africa. But be that as it may, the quality of the generics versus the original products. Your message?
So to register a generic, what we do as the Medicine Control Council is we measure the blood concentration. So basically what happens is some people swallow the originator, and then we look at how the drug goes through the body. And then we look at the generic, and it's got to follow the exact graph of that originator. The factory has to be inspected, and on a regular basis the quality of that medicine is tested. So strictly speaking, you can go from product A to B to C and not notice any difference in terms of how your body is responding to that medicine. If it doesn't respond very well, you yourself or your doctor can fill in what we call an adverse drug reaction form, and there you can say there's lack of efficacy, so that we can then sit with the manufacturer and, if need be, remove that off the market, because we want the community and the public at large to have good confidence in the quality of our medicine.
Right. Amos, the medicines or whatever pharmaceutical product have now reached the local pharmacy. What are the applicable regulations and rules of dispensing? We hear that the scheduling, there's some medicines that, you know, require prescription, some you can go buy over the counter, some actually don't have schedules. Just tell us a little bit about, you know, what governs issuing of medicines in a pharmacy.
Yeah, what governs the issuing of medicines in a pharmacy? I think Lorraine touched on the, you know, the scheduling, and because medicines actually are scheduled from Schedule 0, which can be sold in any shop. And then you also have Schedule 1. Schedule 1 can be sold in a pharmacy under the care of a pharmacist, but by pharmacy support personnel as well. And then you have Schedule 2s. And then Schedule 2s also are sold in a pharmacy, also under the care of a pharmacist. And then you have Schedule 3 upward, which can also only be sold out through a prescription of a doctor. I mean, all this medication, it's actually a kind of a gatekeeping practice, you know, to make sure that they are not abused. And at every level, you know, they are taken care of by appropriate trained health professional. And so that you don't just have, for instance, a Schedule 3 item, you know, just being given without the proper considerations. So we do have our rules, you know, the good pharmacy practice, you know, which also helps the pharmacists in as far as, you know, how to, you know, deal with the issues in a pharmacy.
Lorraine, want to comment further? Yeah.
Could I come in on the matter of repeating a prescription? Because I think that's something that, as consumers, we're sometimes a little confused about it. And I'd like to specifically mention the Schedule 3 medicines that Amos was talking about.
Right.
They're very often things, not always, but very often things that are given for chronic conditions. So I might, for example, have high blood pressure. I might have diabetes. My doctor might write a prescription for me, which I take in, which is only for a month. And then I go back to the pharmacy and now I want more of it, and the pharmacist says, no, the doctor didn't authorize it. There's a good reason that the doctor didn't authorize it. He wants to make sure that that the medicine is actually doing what it wants. And if it's something like an antibiotic, the doctor probably won't write a repeat, because if it didn't work, you've got to go and find out why not.
Yeah. But I wonder how consistent that is, issuing of medicine strictly on the basis of prescription, especially those repeat medicines. But let's take Boyd on the line from Cape Town. Boyd, welcome to Health Talk. Boyd, are you there?
Hello?
Yeah.
Am I speaking to the gentleman?
Yes, you are.
Yes. What happened to me, I've got some thing for cholesterol.
Yeah.
And I couldn't understand why I was getting such cramp. And terrible cramps in my legs, and started to get dizzy.
Right.
So I looked at the instructions, which it says after effects, and I saw that was causing it. So I told the doctor, and they've put me on something else.
Yeah.
So I'm a bit scared of the generic stuff.
I see. Excellent. Thank you very much for that. Do you want to
I don't
perhaps...
see my name on the...
We know.
Sorry, Boyd, I think, is that correct?
Yes.
Thank you for your question, Boyd. Yeah.
So I think that's very easy to respond to. It's likely that drug was simvastatin. And simvastatin, whether it comes out of the original patented drug or the generic, will cause the same side effect. And if the caller wants to appease herself, what she can do is go to a pharmacy and ask for the package insert of the branded product or the generic, and you'll see the side effects are exactly the same.
Yeah.
In this instance, what she's had to do is move to another medicine in that class, which is maybe newer than simvastatin, so something like atorvastatin, which does not have that adverse drug reaction.
I see. All right. I'm afraid we didn't have time. I think we can touch on this when we come back after, because I'd like us to talk about consistency and how we guard against abuse of certain drugs. I mean, there's issues such as codeine-containing products, for instance, to say, how is it that we can protect the public against the abuse of such? Okay. All of that after the break. Please stay with us, guys.
If we're talking health, then let's talk seriously.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
Violence against women, it also talks to such behavior where teachers, instead of educating kids and give them dignity, they strip them of their dignity.
The First Lady.
The First Lady, her action, it's just unacceptable. I must say that. It cannot be condoned. If I had it my way, I would say we had to act and make sure that he goes to jail.
This scourge is not ceasing.
The angry people, the intolerant, it's so huge. So then the scourge finds itself within that particular environment. You cannot say that it's a standalone. It's influenced by social ills, economic challenges.
Join me in Port Sedu live every Monday to Thursday at 17:30.
MedShield, embracing our members in good health since 1968.
Welcome back, and thank you so much for staying with us. We're discussing pharmacy. With me in studio is, on my furthest left, Lorraine Osman. Lorraine is the head of public affairs from the Pharmaceutical Society of South Africa. Next to her in the middle is Gavin Steele, who is the chief director, sector-wide procurement from the National Department of Health. And of course, we're joined by another special guest, Boitumelo Ntswana. Boitumelo is a pharmacist herself with extensive experience in community pharmacy, and she's the executive director of the South African Association of Hospital and Institutional Pharmacies. Welcome to Health Talk, Boitumelo.
Thank you.
Just tell us a little bit about yourself, by the way. You've studied pharmacy, and you know, there was a young caller who said, you know, I'd like to study some more. How can you inspire people out there? Just tell us about yourself, your training, and so on.
Yeah, I just want to encourage that caller who just called in that I mean, obviously came from a township background, studied in the township environment, but because I persistently worked hard, because I had this dream and vision that I wanted to achieve, and I really, I mean, with sleepless nights, obviously worked very, very hard, and there was assistance that I received from the corporates to go study pharmacy at one of the universities, Rhodes University, which is an opportunity for me. So I just want to say to her, help is out there, work hard, you know, focus on the dream. It is possible.
Wonderful, wonderful. Gavin, let's get back to that issue of generics. We hear that, you know, some generics are priced differently, exactly the same product, they're priced differently. So should people be shopping around for the cheapest generics, because they all work the same anyway?
Yeah. Definitely. If you look at a antibiotic, amoxicillin, and you look at how many there are in the market, it changes every month, but there's about 80 different brands. And if you look at the lowest of those 80 and you look at the highest, there can be a 400%, that's fourfold difference in the price. So it's very important for the consumer to ask the pharmacist, can I have a generic? And then secondly, can I have the cheapest generic that you have available? If they are on long-term therapies for chronic disease, such as the lady with her lipid problem, I would also suggest that she can go to the Department of Health website, where you can actually download the price file. We call it the single exit price file for all 26,000 registered products in South Africa. And then what she can do is look for simvastatin in the example that I'm just using, and then she can see the brand names and the different prices and actually find herself a deal that gives her best value for money.
Okay. We have we'll come back to that. We have another caller on the line, Anesh from KZN. Anesh, welcome to Health Talk. Anesh, are you there?
Yes, I am here. Thank you. Thank you for taking my call.
All right.
I just want to know from the pharmacist, with regards, I'm getting a medication that I'm buying from a pharmacy cash. It's called Lyrica, Lyrica.
Yes.
And I can't seem to get it on chronic. I'm a post-transplant renal patient. I'm a diabetic patient. I've got severe peripheral neuropathy. I want to know if it can be gotten chronic, and what are the procedure and ICD-10 code for me to tell my doctor to apply.
Right. Well, let's give it to the pharmacist.
Thank you, sir.
Okay.
Thank you for your question, Anesh. Yeah?
Okay. I presume the caller is on medical aid.
Yeah.
If you are on medical aid, obviously medical aids are supposed to cover what we call prescribed minimum benefits. Those are 25 chronic conditions that they are supposed to cover. If, for instance, that particular condition that the doctor is treating for that particular patient, and he has prescribed Lyrica, which of which the patient must take, if according to the medical aid that the patient is on or the caller is on, it is not falling under their, what we call it, their drug list, chronic drug list. If it doesn't fall under that, there are pharmacists who are working inside the medical aids who does a program called Drug Utilization Review, where we look at the clinical prescription, and we also look at the rationality of the clinical prescription and also the cost of the prescription. But remember here, we're trying to improve the outcome of the patient. If the patient is not satisfied and the doctor do want to get the item on the chronic prescription to be approved.
Yeah, but sorry to interrupt. And there are alternatives that can be given to this. Yeah?
First of all, there will be alternatives that will be recommended. If not, the patient can then escalate it with his or her doctor to the medical advisor of that particular medical aid, where the case of the patient will actually be taken into account to say, this patient really needs this drug, and it is, it will improve the clinical outcome of the patient.
Okay. Gavin, you want to add on to that? Yeah.
So from the Department of Health perspective, the patient can go to the Google Play Store or iPhone App Store and search on Department of Health clinical guidelines, and they will see the essential medicines list and standard treatment guidelines. That's a cell phone app, and if they download that, they will then be able to search for their disease and see what is a recommended standard for government. And that should be the very basic that he is entitled to from his medical scheme. And then I think the other issue is also to have that discussion with their local pharmacist, because usually the local pharmacist will have good knowledge of the medical schemes and their formularies and be able to assist the patient in finding a long-term solution in consultation with the DUR pharmacist.
All right. Lorraine, let's move to a slightly different... now we're talking about the pharmacy facility itself now. What's an ideal pharmacy facility? Should it be selling cigarettes or sweets or toothpaste? What should a pharmacy look like?
You ask quite a difficult question, particularly seeing that there are how many pharmacies in this country? Maybe 3,500 community pharmacies, and every one of them has a different layout and a different model. They're not allowed to sell cigarettes to start with, which I think is quite an important thing. In fact, we encourage them to enter into some sort of smoking cessation programs with their, or rather we encourage them to help their patients to enter into that. There are restrictions as to what they can sell. What is most important, and this is where Amos would tell you that they do have rules, not even guidelines, rules for pharmacy facilities. For example, the medicines that are for prescription only, and even those which, for example, the Schedule 2s, must be put into an area to which the public doesn't have access, because we want to keep the patient safe. We don't want them coming and perhaps taking the wrong thing there. They also are very strict about even the quality of whatever the flooring is and the countertops, because it has to be something that is going to be safe even after all the washing that has to happen on it. So there are rules saying what a pharmacy must look like. They want you to have an area when I hand your prescription to you, you should actually be reassured that you have privacy there, that you're talking only to me, and that we're not having a queue of patients standing right there where they can hear your personal problem. So that is the kind of thing that the Pharmacy Council looks at when it evaluates whether a pharmacy is acceptable for that purpose or not.
Well, who polices that? I mean, clearly when you walk into a pharmacy, you see all sorts of different things.
So the South African Pharmacy Council has a team of inspectors, and on a 3-year cycle they go and do what we call good pharmacy practice inspection. And then that inspection report comes to the Pharmacy Council, and then we have a look at whether or not that pharmacy is compliant. So that's the first issue. I think the second one is, if a member of the public is concerned, they are fully within their rights to contact the Pharmacy Council and lay a complaint against the pharmacy. I would argue, for example, that in a pharmacy, given our current approach as the Department of Health, we should no longer find fizzy drinks like Coca-Cola and those sort of issues sold in a pharmacy, because we've introduced sugar tax due to the fact that we have evidence to show that high consumption of these agents lead to long-term health problems. And so you would expect, in my mind, a pharmacy to reflect a health-conscious environment.
What's your view, Witima?
I must support Mr. Steele on that, in that especially with community pharmacies. I mean, these communities are embedded, they are in our society. They are the first point of access for the ordinary patient. So it must reflect that health environment that we're trying to encourage for patients to adopt. We are there as community pharmacists to to offer health promotion services, to offer health preventative services, to offer curative services. And we are going to add to improve our services to go and expand and offer things like rehabilitative services and your palliative services.
All right. So essentially there should be a difference between a supermarket and a pharmacy.
Yes.
All right. We're going to go for a short break. When we come back, we're now going to a final discussion segment on the pharmacist. Please stay with us.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est si bon.
We're talking news, business, and sporting updates both continentally and abroad. South Africa is in its first economic recession since 2009.
Currency has appreciated, quite a lot, especially for this year. And it has benefited from a number of things, not so much to do with what was happening here at home.
The Islamic State-linked news agency Amaq claims the latest attack was launched because of Australia's backing in the US fight against the group.
Constad is one of the dozens of women who have accused Cosby of sexual assault, but hers is the only case recent enough to be subjected to criminal prosecution.
Stay tuned to News Today at 3 p.m. from Monday to Friday on SABC News.
MedShield, embracing our members in good health since 1968.
Welcome back. Now we're talking pharmacy and we're going to be talking about the role of the community pharmacist, and we've been tackling all other important issues around pharmacy. The special guest with us today, Boitumelo Ntwane, who's a pharmacist herself and executive director of an organization called SAHIP for short. And of course we still have Amos Masongo, CEO of the South African Pharmacy Council, and Gavin Steele, Chief Director, Sector-wide Procurement from the National Department of Health. If I could start with you, Gavin. Yeah. Earlier on we spoke about, you gave us that, issue around the differences in the prices of some of the generics. The one question is there incentive for the pharmacist to dispense the higher priced generic product? By the way, I also had a question from one of the crew members to say, why is it that some generics, especially essential generics such as drugs, for cancer, so expensive?
So I think I'll start off with the single exit price. So basically, as the name implies, it doesn't matter which pharmacy you go to in the country, you should pay the same price for that medicine. So if it's brand A and you go to pharmacy 1, 2, and 3, you should pay the same price. What may differ is the dispensing fee, and so there's a maximum dispensing fee which can be discounted. But the price is a set price for the medicine, and it is exactly the same. Within generics, there will be different brands, and they can be priced differently, and that's why I was saying earlier, ask for the lowest priced brand But if you buy that brand, you know that you cannot get it cheaper anywhere else in the country. And in terms of the dispensing fee, the pharmacist makes their money on the dispensing fee. And the way the dispensing fee is designed by the pricing committee who regulate the price of medicines, whether you dispense a very expensive medicine or a very cheap medicine, you make the same money.
Right.
You will see the fee might differ, but that's because the cost of production is higher for the bigger medicine. They've got to hold money on their shelf before they sell it to you. But strictly speaking, at the end of the day, whether I sell you a cheap medicine or a very expensive medicine, the profit I make out of that as a pharmacist is basically the same.
Okay. I was, in the last segment, we spoke a little bit about, standards in a pharmacy, what an ideal pharmacy should look like, and, the questions around the policing around, ensuring that a pharmacy does what a pharmacy is supposed to do. Your comments on that, please.
Yeah. Gavin commented on the inspections of pharmacies. We have inspectorate, throughout the whole country, and these inspections are based on, the activities of what happens actually in a pharmacy, and they are also based on the good pharmacy practice in South Africa. And these pharmacies, as they are inspected, they are actually also graded in the same process. You'll find pharmacies which you call grade A's, and then you'll find pharmacies which you call grade B's and C's.
Yeah.
So grade C pharmacies are those pharmacies that are a bit battling in terms of meeting the the adequate standards, and then the grade A's are those pharmacies which are at the top.
So what do you do with the ones that are battling? Are there instances where you revoke licenses?
There are instances where we do revoke licenses, but it's quite an elaborate kind of a process.
Right.
But the immediate thing that we do, we send them for disciplinary, and then we have processes, that looks at these issues. A pharmacist might be called in to come and explain certain things.
Yeah.
But there's also a process for them when they are falling under that category,
yeah.
For them to respond on certain things that have been found,
okay.
and then to give us an assurance when those inadequacies, for instance, will be met.
All right. I'd like us to now talk about what we are really meant to talk about in this segment. That is the role of the community pharmacist. But before that, let's take Anonymous on the line from KZN. Anonymous, welcome.
Good afternoon. How are you?
We're good. How are you?
No problem. I like to only expect to talking about the pharmacy. From when are we coming in a pharmacy and he's selling cool drinks, he's selling chocolates, he's selling everything? And another thing is, I think it's unfair. When you go to a pharmacy and you're buying medication, the other pharmacy you're paying more money, but the other one don't ask us any levy. So I like to know from when this came is the one who's selling chocolates, cool drinks, and everything. One day you can go to the pharmacy and buy bread. What about the other people like the shops who's selling food and all that stuff? So that I think it's unfair. Your people in the Minister of Health must solve this problem. And then also the unions must also stand together and stop this thing. Because you can go and buying bread, you can go and buying cool drink, go and buy chocolates and everything. A pharmacy is there for medication. Right. A pharmacy is not there for cool drinks. A pharmacy is only there for medications. So other people, as you can go and check how big is the Skims building.
All right. Thank you very much. Thank you very much. I think you made your point. Thank you so much, Anonymous. I'm not so sure that anybody would like to comment because I think we've touched on a few of those issues. Yeah?
I think
shortly.
I think the important thing is, as I said, pharmacy should be an environment where you go in to improve your health. And there's a whole range of products which go towards health promotion. And so typically we expect those pharmacies to carry those lines, those things that are unhealthy, as a caller referred to. I think over time we will address those things.
Before we run out of time, Butima, let me ask you, what is the role of a community pharmacist?
The role of a community pharmacy, like all pharmacists, we are custodians of medicine.
Right.
We are there for our patients to be able to come to us and say, I'm coming for my health check. What do I need to do to prevent this condition? What can I, as a person, educate myself on my condition? How can I manage it? We are there in terms of, access. The department is now talking about accessible, quality, affordable healthcare to the ordinary, all South Africans. We are there on their doorsteps, in their communities, in residential areas, as professionals, to say, come to us, we will advise you. There are counterfeit medication that is out there that we can actually advise you on. If you have any drug interactions that you might not be aware of, we are there as pharmacists in your communities to help you. So our people must make sure and utilize our services, that we are there to make sure that the clinical and patient outcome is improved.
Okay. This is National Pharmacy Week. Yeah, you want to comment perhaps?
No, in fact, I just wanted to add about the issue of the Pharmacy Week,
yeah,
which is also part of the role of the pharmacy. And previously it was actually just, a Pharmacy Week. Now it's a Pharmacy Month. And the theme for this Pharmacy Month is don't wait, vaccinate.
Yeah.
So it also just tells you that, there are so many things that happens in a pharmacy, and there are so many things that actually pharmacists do to educate the public on health promotional issues. And so for this month, for instance, we are encouraging vaccination. We are saying to the public they must actually visit their pharmacist, and just to go and look at, be told about the benefits of vaccination. Whether they are vaccinating, as you know, that the vaccination helps to prevent diseases. Vaccination, helps in so many other ways. That
are there any particular types of vaccines that are being promoted, perhaps, at pharmacies?
Well, there are not particular vaccination that have been promoted, but you look at all vaccination. You talk of people that are traveling.
Right. You need to. If anybody is in need of a vaccine, the pharmacy is the place.
A pharmacist.
Well, I'm afraid, Governor, I was going to give you 10 seconds, but I'm afraid we've run out of time. Well, folks, this is all we have for you today. I want to say thank you so much to all our guests. Gavin Steele, Chief Director, Sector-Wide Procurement from National Department of Health. Amos Masango, CEO, South African Pharmacy Council. Lorraine Osmal, that we had earlier, Head of Public Affairs at the Pharmaceutical Society of South Africa, and of course, Buitumeleng Nzwane, Executive Director, South African Association of Hospital and Institutional Pharmacists. Thank you so much, guys. Well, again, thank you so much for staying with us. We meet you again next week, same time, but in the meantime, I'm Dr. Solomon Down. Please do take care.